It's time for the digestive system. Very excited about this. Let's just talk briefly about the structures and the functions. It's pretty straightforward. It starts at the top and ends at the bottom. And it consists of organs that make up what we call the alimentary canal or the digestive tract. And the functions include breaking down food to form a form that can be used by the body cells. It includes transporting food, waste, physical and chemical breakdown, absorption of digested food, and then finally the elimination of waste. Of course, digestion begins in the mouth. That's where food is ingested. That's where mastication or chewing happens, and deglutition. In the pharynx, there's the nasopharynx, the oropharynx, and the laryngopharynx. And as the food travels down, it goes into the from the mouth into the esophagus into the stomach by way of the esophagus. Of course, in the stomach, there's chyme that breaks down the food, and the digestive process of proteins begin. I didn't say it before, I don't think, but the digestive process of carbohydrates begins in the mouth. Then the food travels to the small intestine, and in the small intestine, right off the stomach, there's a lot of juices that happen, and that's where the digestive process continues, and the nutrients are absorbed. And then the large intestine, it's mostly water from ingested food is absorbed back through the large intestine by way of the bloodstream, and so that's where the fluid balance happens. And that's just to kind of give you a frame of reference. If you have a stomach bug and you have watery diarrhea, it's because everything's traveling so quickly and the large intestine's affected, so the water absorption can't take place. And then in the peritoneum, that's where the digestive bodies are primarily located, and that's where lubrication and friction prevention occurs, because the peritoneum or inside the abdominal cavity, it's kind of lubricated. So here's a little picture. And starts with the mouth, and then the pharynx and the esophagus. The salivary glands help with the digestion or the breakdown of food, especially carbohydrates, in the mouth. And in the stomach, that's where the food is kind of churned up, and there's mucus there to help protect the lining. The liver stores vitamins and iron, and old red blood cells are also destroyed there. And the bile that's secreted will also, in that hepatic system, help with the food digestion. The pancreas regulates your blood sugar levels, and the small intestine, again, is where digestion is complete and the nutrients are absorbed, and then to the large intestine, where the water is reabsorbed, and then fecal matter is formed, and it's stored in the rectum, and then the anus is used for the ejection of the fecal waste. 3 accessory glands that aid in the process of food breakdown: the pancreas, which has exocrine and endocrine functions; the liver, which produces bile and helps to digest fat. It converts sugar to a storage form. Remember, you need sugar for energy. Got to with the help of the liver, it allows you to actually utilize the sugars that you take in. And also the liver stores fat-soluble vitamins A, D, E, and K. Remember what vitamins are fat-soluble, because it spells attic, kind of phonetically. And the gallbladder stores the bile until the small intestine needs it to break down food. So some assessment techniques, of course, there's x-rays, there's barium. I don't know if some of you got to see barium swallows, where they drink that contrast, they call it, and it makes its way down the digestive tract, and it shows up on x-rays. There's endoscopy, where a tube is actually inserted either rectally or down through the esophagus to take a look at the digestive bodies. There's gastric analysis, where they remove some gastric contents of the stomach and analyze that to see what enzymes are present. There's fecal analysis to see if there's any blood or microorganisms in the feces, and then also palpating and listening for bowel sounds, or palpating to see if there's tenderness or if the bowel might be full of air, those kind of things. This is an endoscope, and you guys will get to see that when you do the day surgery, hopefully, at the Guthrie across from the mall. Some disorders: alactasia, also called lactose intolerance, is when there's not enough enzyme, the enzyme lactase and not enough is produced. So unabsorbed lactose ferments in the intestine, and it leads to gas and cramps and diarrhea. So people who are lactose intolerant get very bloaty, very gassy if they've had ice cream or cheese or milk. Those things can all be triggers. Appendicitis is the inflammation of the appendix, and cholecystitis is inflammation of the gallbladder. Remember, the suffix itis is always inflammation. Cirrhosis is a chronic problem with the liver. The liver chronically deteriorates. Sorry, I had to answer the phone. So cirrhosis is that degenerative condition of the liver, and then scar tissue forms, and the liver stops functioning, stops being able to filter and store, and it's usually a result of some kind of chronic chemical or substance abuse, but it can be from other things that have damaged the liver. Colon cancer is when there is some kind of abnormal growth in the large intestine. Remember, cancer cells are mutation cells, so that constant irritation that happens in the bowel or in the colon can cause the cells to just start to mutate in new ways, and then that's a cancer. So that's why people have to have endoscopies or colonoscopies recommended starting at the age of 50. Constipation, I'm sure you're all familiar with the inability to push the stool out. Crohn's disease is the inflammation and ulceration, usually in the ileum or the colon or both, and causes a great deal of digestive problems and discomfort, sometimes surgery to remove some of the affected bowel. Gastritis, anything ending in itis, is inflammation of. Gastritis is inflammation of the stomach lining. Gastroesophageal reflux disease, you may have heard of this, or GERD. It's frequent heartburn or chest pain. It's actually the stomach acids coming back up through the esophagus and causing discomfort. And it can also burn the esophagus and lead to esophageal cancer if it goes untreated. Halitosis, it could be caused by bacteria, but that's bad breath. Heartburn, again, that burning sensation when there's a backflow of the chyme or that acid in the stomach. A hemorrhoid is when the veins in the lower part of the rectum dilate from pressure, and they actually sometimes pop out of the rectum and hang like bunches of grapes outside of the rectum. They're very delicate, they bleed very easily, very uncomfortable to sit on. Sometimes you see people who have them sit on donut-shaped pillows. And hepatitis is a viral or can be a bacterial infection in the liver. There are several forms of hepatitis. Hepatitis just simply means inflammation of the liver. There can be multiple causes. Mumps, something you all received a vaccine for. The parotid glands in the neck become infected by a virus. Very, very uncomfortable. Often people would end up with permanent problems from the infection, or sometimes even death. It was a really rough childhood illness, but now it's almost been eradicated in this area, in this country, because of the vaccination program. Pancreatitis is a mild or could be a chronic ongoing condition resulting in the gallbladder having stones, or there could be diseases or injury or alcoholism that cause the pancreas to be inflamed. And peritonitis is the inflammation of the abdominal cavity caused by bacteria, and so usually the patients are very uncomfortable, have tenderness in the abdomen, and a fever because it is a bacterial infection. Phenylketonuria is inherited, and all babies born in the United States are tested for PKU or phenylketonuria. You'll see sometimes in like a diet, anything with aspartame in it, you'll see, attention, fetal ketonurics contains phenylalanine. Phenylketonuria is an intolerance of the phenylketone that people might ingest. So if you never take phenylalanines, like you don't use aspartame or foods that it can contain phenylalanine, then you can prevent that mental retardation. But if people don't get tested, then they won't know that they have that sensitivity, and they could end up with a child who's mentally retarded. Pyloric stenosis is a common birth defect where the pyloric sphincter doesn't allow food to pass into the small intestine. There's like a little bubble there. And sometimes babies, when they're born, after they've been home for a couple days, will start to do this crazy projectile vomiting. And the first thing you want to do is a gastric visualization with some swallowing of barium, and see if you can see it pretty easily if there's some contrast swallowed by the patient. Tay-Sachs, a recessive genetic order in which fat cells accumulate in the body and cause damage to normal cells. There can be tests for that, but the treatment is not very effective. An ulcer can happen in the digestive tract. For a long time, it was thought to be caused by stress. Now it's believed to be caused primarily by bacteria and be treated with antibiotics. It can have foodborne illnesses like salmonella, which happens from handling raw chicken or unwashed chicken. E. coli, which is a fecal bacteria that's not washed off somebody's hands and then they handle food and ingest it, or it's on a surface. There could be people who have sulfite sensitivities. There's a lot of food with sulfites in them, like wine is one of them, and there's other foods, and people will get illnesses from the ingestion of those. We'll talk a little bit about eating disorders like bulimia and anorexia, and I'm going to show you a little movie about that. And it's pretty fascinating and very difficult gastrointestinal disorders to treat, because they're also connected to a lot of other things that are involved with mental health. There's the new thing is these designer foods, these biotechnologically engineered foods that have new tastes, new flavors to make them more appealing, like vegetables and fruits are being bred or being developed so that they taste better, taste sweeter, taste is more appealing, so that people will get the nutrients that they need by eating their fruits and vegetables. We're striving for 5.